Good afternoon. I'm your consumer investigative reporter, Cassidy Williams. In today's debut episode of the I-Team stream, we're exploring what your options are when a healthcare claim gets denied. A Wethersfield woman learned how complicated it can be to get a claim approved. Here's her story.
Come here, let's do the puzzle together.
Toddler Layla Nielsen has a big personality.
Thank you.
But that big personality started out as a 3-pound preemie.
She was a peanut. Definitely a life-changing event to have a NICU baby.
After more than 50 days in the NICU, Layla came home. On doctor's orders, her mom, Kelly, fed Layla a special neonatal formula.
It was scary. It was regimented. I'm a first-time brand new mom, so I'm like, oh my God, what do I just have this peanut of a baby, and you know, I'm gonna follow everything that I'm told to the T.
Neonatal formula isn't cheap, but it can be covered by insurance.
You name it, I kept it.
Nielsen kept all her receipts and submitted a claim to be reimbursed for around $600 worth of formula. But months later, it was denied.
The lady said, you didn't fill out the form right, you missed an NPI, some doctor code number that the pediatrician knew.
NPI stands for National Provider Identifier. It's a unique code that connects a claim with the doctor.
So it can be very complicated to fill out the forms, but what's really important is to try to fill out as much information as possible to avoid getting the claim rejected.
Kathy Holt is Connecticut's acting healthcare advocate. Her office helps people in the state work through insurance denials and appeals for free. It's a resource Nielsen wishes she knew about.
Oh, you're a monster?
Holt says 65% of calls to the Office of the Healthcare Advocate are about denials. 40% are denials for medical necessity. The other 25% are administrative denials, or what she calls connecting the dot cases. Think of filling out a healthcare form like a game of connect the dots. If you miss even one dot along the way, like an NPI number, you could be denied, and the burden is on you to figure out what dot you missed.
The complexity of insurance and the quickness to deny services rather than to fix the problem that may have arisen, the box that wasn't checked, or the signature, those sometimes take a little while to uncover.
What do we got? Oh, headphones and music?
Like Layla's matching game,
Headphones and music? Good job. High five.
Kelly Nielsen tried to connect what her forms were missing on her own.
How much time do you think you spent on the phone, sending emails, filling out forms?
At least two days.
But she kept getting denied.
I think in total I was denied 3 or 4 times. And it's like they make you do extra work that's gonna be wrong, that you don't know, so they don't have to pay you and they don't have to give their money away.
When we asked Nielsen's insurance provider, Anthem Blue Cross Blue Shield, to find out what happened, they explained in a statement that the first time the claim was missing the prescription and a diagnosis code, and went on to say, "We understand the back and forth with the member caused confusion and ultimately resulted in no action being taken. We sincerely apologize for that mistake. We have now contacted Layla's provider to obtain the necessary information, and we have approved the claim for the formula."
That's an entire month's worth of groceries. That's a car payment. That's almost more than half of our mortgage. It's our bills. It's everything.
Hey, look, I found the butterfly.
The money is now on its way back to Nielsen. The game of connect the dots finally complete.
Good job, baby.
Now, anyone in Connecticut can use the Office of the Healthcare Advocate to help with an insurance denial or appeal. We are now joined by the state's healthcare advocate, Kathy Holt, no longer acting as of last week. Congratulations. So now these connecting the dot cases, as you call them, where do you even begin trying to figure out what piece of information you might have missed?
So that's a great question, Cassidy. Thank you so much for having me today. We get as much information we can about what the insurer is saying is the reason that they're not paying a claim. So if someone calls us and they say, I've been denied, or I can't get a payment, or there's a billing problem, then we will get as much information from the individual as we can about where they went to, what procedure they had, and then we will follow up to get any kind of information that they've already gotten from the insurance company, to see if we can glean from the denial the specific information that the insurer is looking for. If they don't indicate in the paperwork what the problem is, then we will contact the insurance department directly on behalf of the healthcare consumer to make sure that we can figure out what the problem is so we can help get it solved.
I know Kelly Nielsen in the story, I remember she asked me, why wouldn't the insurance company just call me and let me know, hey, you're missing this piece of information, what is it? In your experience, is that pretty standard that insurance companies won't let you know, they'll just deny a claim instead?
Yeah, I think what we're seeing a lot of now is that insurance claims are not being reviewed by real people. They're being put through a system where the electronic reviewer may look to see if all the fields are completed and if the numbers match. For instance, if it's a problem with not having the correct identifying number, as you mentioned in the piece, or it might not be the correct code for that procedure. So the electronic reviewer will determine if there's enough information that shows how to pay the claim. And without that, it just kicks it out of the system. And sometimes it's because a date has been left off or a name. Particularly, we see this quite often where a name on the claim doesn't match the name on the insurance card. So the insurance, for instance, might see that I'm Kathleen Holt, but the provider might have put it in as Kathy because that's what I typically go by. So if the name doesn't match exactly, even to the middle initial or the middle name, these claims will get kicked out of the system and be denied.
And going through that appeals process, how quickly do you need to act? Are there any time restrictions sometimes to get these things fixed?
Yeah, there are time restrictions, and it depends on where you're at in the process. So when you get a claim denial from an insurance company, when you get something in writing, they're required to tell you how long you have to act before it's outside of the appeal time frame.
How long are those appeal timeframes typically?
Yeah, typically, again, depending on where you're at in the system, it could be a 30-day act time, it could be a 60-day, could be as much as 6 months. And typically you have up to a year to file a claim after you have a procedure done. And usually that's done by the provider that you see that will file the claim on your behalf to the insurance company.
Yeah, so tell me a little about your office and the people, like the knowledge that they have to work through all of this, because it can be so complicated for the average person.
Sure. So our office, the Office of the Healthcare Advocate, is a state agency. We've been around for 25 years, and we have grown to a staff of 18 people. We have groups of people that do the consumer information intake. Those folks, they're known as consumer information representatives. They will field the calls or the emails that come into our office, and it can be as easy as someone just saying, I need help. And then we'll get back to them if it's an email or a message that's left for us. And then we also have attorneys who are very skilled in all the different types of insurance that there are. And we have nurses and paralegals, and they work sometimes as teams depending on the particular issue. If it's a medical necessity denial, typically those go to our nurses because they're more clinically tuned to maybe what needs to be addressed.
Yeah, let's talk about those medical necessity cases, because I know our story focused on the connecting the dot cases, but the larger majority of denials are medical necessity. How do denials for that work?
Yeah, so usually what happens with a medical necessity denial is the denial is very generic. Like, you don't need this service, and it could be a denial of a prior authorization before you get the service, or maybe you already have the service, but you get a denial for claim payment. And the difference doesn't really matter as much as finding out how to fix it. So in a medical necessity denial case, it typically is due to a lack of documentation. So perhaps the doctor or the hospital, depending on who the provider is that's sending in the claim, may not have provided all of the chart notes, or they may not have provided the reasons behind why something is medically necessary. And oftentimes those cases end up with what's called a peer-to-peer review, where the doctor who either ordered the test or delivered the service, for instance, may contact the insurance company and say, let me talk to one of your medical directors at the insurance company. What are you missing? What do you need? What additional information must you have in order to process the claim?
And back with the connecting the dot cases, you talked about how a lot of these claims aren't even first looked at by a real person. Is it the same thing with medical necessity, where your doctor is prescribing you this treatment and there's a computer somewhere saying no, and you have to kind of almost fight the computer?
Yeah, that's hard to know without kind of being in the depths of the insurance company. I would say for the most part, if it is a medical denial, that somebody would have to at least had a cursory review of that. A real person would have had to have looked at that in order to determine a medical denial. But again, they are looking for specific procedure codes, for instance, or they're looking for specific documentation. And because my interpretation of this is there are so many claims that pass the desk of these medical directors at the insurance company, they don't spend a lot of time looking or trying to fix a problem. If the information is not there, it then becomes the burden of the provider and the patient to fix the problem. Again, even if you can figure out what the problem is.
Yeah, it's all so confusing. What's your number one piece of advice for someone trying to navigate all of this?
Well, I guess my number one piece of advice, and I hear this all the time from people in our office, is to call our office, because we frankly have backdoor contacts into the insurance companies. We can get answers more quickly than if somebody is calling the direct customer relations telephone number that may be on the back of an insurance card. So in order to avoid the problems, I often say to people, make sure that you do as much as you can to be clear about what process is going to happen so that all the documentation goes where it needs to go. The problem is so many people touch everything from the beginning of when a patient goes into the office and maybe sees a doctor, or goes into a hospital and sees, and goes through the hospitalization process. There's so many touch points that you can't, as a patient certainly, you can't control everyone that's going to be working with your medical records or knowing what your medical records say, or making sure that something is documented in a way that passes the test that the insurance company puts out. So, I think the number one piece of advice, to go back to your original question, is to be persistent, because you shouldn't take it personally, which is the strangest thing to say. There's nothing more personal than health insurance. But we are able to win the cases that we take, we will help everybody, but we win about 80% of the time, because people who call us really know that they deserve the services that they have received or will receive, and those claims should be covered.
Yeah, and you said great piece of advice is to contact your office. So let's just go over the contact information for the Office of the Healthcare Advocate. You can call 866-466-4446. You can also send an email to healthcare.advocate@ct.gov. And before we wrap things up, was there any other advice or any other things you wanted to let people know about your office or the healthcare denial process?
Sure. So I know a lot of people like us to answer the phone directly. I will say that we are most efficient when people leave us messages, and we try to return them the same day if possible. If not, then the next day. So don't be discouraged if you call our office and you get a recording. Please do leave a message. We have people that are monitoring those calls, and we'll take them first come, first serve. And we hope that other people in Connecticut will use our services. I will say, because I hadn't said this earlier, everything is for free. We don't charge for our services. So we're happy to help anybody who has an insurance issue in the state of Connecticut.
Now, is that voicemail option even quicker for you guys than sending an email? Is there a preference there, or either or?
So our team has something that they call the box, and the calls go into the box and the emails go into the box. And our team goes right in and, as I said, takes the first one that's on the top as they roll up. So it doesn't really matter whether you email us again, healthcare.advocate@ct.gov, or if you call our office, we will respond equally at the same time.
All right. Thank you so much for joining us, and thank you for tuning in to our first iTeam stream. Join me and Chief Investigative Reporter Sam Smink here on WFSB Plus each month as we share information from our investigations that could help you. And don't forget, if you need the iTeam's help, fill out the form on the Channel 3 app. Just click on the iTeam tab.